If you're someone out there suffering with CRPS or chronic regional pain syndrome or some of the forms of it like AMPS, amplified musculoskeletal pain syndrome, if you're just somebody struggling with pain and nobody knows what it is and how to get rid of it, and you're in these repetitive cycles or continuous cycles of not going away, not getting the answers you want, not getting the solutions you want. Well, I'm Dr. Chris Cormier, and I've been in practice now for almost 3 decades, and our focus is on some things in the body that you probably never heard of. In fact, we're going to talk today and have this conversation about the brain's communication with the cells and how to restore it. I think you're going to really enjoy this conversation. It's going to give you some hope. It's going to give you some realizations that there's some things you've never thought about when it comes to your overall health. So I hope you enjoy it.
Hello, today I'm with Dr. Chris Cormier, and we're going to be talking about CRPS. Hello, Dr. Cormier.
Hey, Cameron.
How are you doing today?
Great, how are you?
I'm doing well. So this condition is actually one that I personally have not heard of before. So to start simply, what does CRPS stand for?
Chronic regional pain syndrome.
Okay. Why is CRPS often misunderstood as just pain instead of a nervous system condition?
So I guess when people start to have areas that hurt so bad and they won't go away and they don't know what's causing it, there can be a lot of misconceptions about what is the culprit and what the diagnosis really is. And with pain, it's such a wide variety of pain that people can get that people are oftentimes just trying to figure out, why is this not going away?
Yeah. Can CRPS begin after something small, like a minor injury or surgery?
It absolutely can. Remember, we have 30 trillion cells, right? And any one of those cells in your body can get damaged by stress. So we have emotional stress that we go through on a daily. Small or big emotions can cause damage to cells. But you also have physical stresses, which could be a posture inactivity. It could be a big injury you have, fallen, down. It also could be anything environmental stress, right? So anything in the environment. It could be Wi-Fi causing problems to cells. It could be foods or drinks or chemicals or pollutants or toxins, additives, preservatives. Lots of different things to think about that affect groups of cells, cause those cells to be unhealthy, and those cells start crying out with pain for you to fix them.
Yes. Why does the pain sometimes spread or intensify instead of healing?
So let's go back to chronic regional pain syndrome. It is an autoimmune condition, right? So opinion on autoimmune is a lot different than everybody else's opinion. Most people think, the conventional side thinks the immune system is erroneously attacking healthy cells in the body. But my opinion is the body is trying to get rid of these unhealthy cells that are there. So let's say this arm starts hurting really bad, and I do get diagnosed with, let's say, a chronic regional pain syndrome. Well, basically these cells are crying out that something is not right in them, and we got to fix those cells. So the way we do it is a lot different than everybody else. We basically make the brain, because remember, your brain is your power company. It's wired to all these trillions of cells. So when the brain loses connectivity or power to a group of cells, well, those cells start to hurt. That's one of the signs or symptoms you can get.
Does CRPS affect adults or differently?
Not necessarily. I mean, cases we've seen, they have intense pain, and even some of the cases we've seen, if I'm just even approaching them like this, they don't want to be touched, right? It's just a tremendous amount of discomfort and pain that they experience.
Are you seeing certain ages or life stages more often with CRPS now?
Weird. So used to be, I think, more in adults, but now we've actually seen 3 different children. One was 8, one was 9, one was 11, and literally they were normal children, and then had history of sinus issues, whatever, that type of stuff. But literally they just got a virus, then got an autoimmune condition, a form of CRPS. It's called AMPS, which means amplified musculoskeletal pain syndrome, and all 3 of them were paralyzed. Yep, right after that. So luckily they came to us and we were able to do everything to fix them.
Wow, that's amazing. What happens when people are told the pain is out of proportion or in their head?
Okay, it's definitely not in their head. And I guess there can be a component to it. Is you have two sides of your nervous system, right? You have one that's a healing side called the parasympathetic, and you have one that's a worried, surviving, fearful, anxiety side. So when this side stops working really good, you can't heal. So then the anxious and the overwhelmed and the surviving side takes over. And then the less you take care of the damaged cells that are in the body, the less this side can work, and then this side even gets more. And the next thing you know, they're really sympathetic dominant. That'll create even more paranoia. It can kind of feed itself if you don't do the right things.
Why does CRPS pain feel intense, burning, or unbearable, even without a new injury?
So with these, just think of it like cells that have been damaged, right? They're so damaged that they're crying out for help. That's the best way I can describe it. And so in every case what we do, there's input. So for instance, if I stick something sharp here, the craziest thing, but that's an input into your brain. If those cells are properly connected with something sharp, milliseconds, I should move and be like, oh yeah, sharp, right? Well, we'll have certain senses that people lose where input is not good into the brain. So we'll put something sharp here, let's say, and they won't feel it as sharp. They'll be like, oh my goodness, that feels good. So we have to do some neurological specific exercises to turn that signal back on and get that input back in. And that's just part of the input into the brain through a nerve to a group of cells, right? But you also have output. So like if I'm gonna move my hand this way, when our brain is having to send light energy, fiber optic light energy down through a specific nerve into a specific muscle to make it move. And so what we find in these conditions like chronic regional pain syndrome, there's oftentimes a problem in the input as well as the output.
Why can touch, temperature, or movement make symptoms worse?
So again, the input is off, right? You can't feel the right sensations. So just sometimes, if I just touch on a patient with bad cells and bad CRPS in a certain area, if I just go and barely touch, they feel that as pain, when they should just feel it as light touch, right? It should feel like, oh yeah, it's nothing, just light touch. But if the signal's off, they'll feel it as pain. So those signals we got to get back, and we got to get those cells to properly interpret what they're feeling.
Yes. Patients are also told nothing is wrong structurally. Why doesn't the body accept that?
Okay, so there's something that people don't think about. And these nerves, for instance, all right, most people think a nerve has to be pinched to not work. That's actually false. So I want you to think there are plenty of pinched nerves that can work just fine, and there's plenty of unpinched nerves that are not functioning properly. And all this is just direct communication between a cell and the brain through a nerve, either to the brain or from the brain to the cell. And imagine there's a light energy flowing through that nerve from the brain down into that cell. That's every cell in your body, which is crazy to think about. So that energy flow that's flowing through a nerve, you can't see on an MRI. You can see the actual nerve on an MRI, but you can't see the actual energy flow flowing through it. And that's the misconception that people have is, you know, MRI's clear, no nerve pinched, and everything should be good, and that's not the case at all.
What early warning signs of CRPS are often missed or dismissed?
So pain. So like we'll have something and they just pop a pill and they hide it, right? And it maybe goes away temporarily, and then it comes back, and it comes back, and it comes back, and it gets to a point where it just stays, regardless of what they're taking. My suggestion would be the earlier people come to us, we can fix things quicker. But if they wait too long, then it gets to where, like I mentioned, we had those paralyzed children. If they would have come to us early on, we could have prevented a whole lot of excess money that they spent for no results. But we really helped them get over a condition quicker.
When someone with CRPS walks into your clinic, what do you notice right away that tests don't show?
So exactly, we go through a very detailed history with every patient coming through, regardless of the condition, but especially in this one, we want to know that you've been through, all the stresses in your life, your emotional stresses, your physical stresses, your environmental stresses, the things that you've been through that have made your cells in your body get weak and that you maybe didn't even think about. And then we go through a very detailed neurological examination where we examine the power in the brain to the cells. And there's 88 primary nerves that come off the brain and spinal cord. They're like big power lines. So we test the energy flow from the brain to those parts of the body because we know where every nerve goes and what it does. And then we basically give a percentage, like whatever percentage powered up you are. And most people come to us in the 30 percentile or less with this condition. So that process starts the brain communicating better. It actually makes the energy flow go to those cells to start the brain's recognition of where it's weak. Then we come up with customized plans on whatever that person needs. And not only is it about the light energy like we talk about, cells, it's also about oxygen because oxygen is the number one ingredient. So we got to get oxygen back to cells. Most people don't breathe enough and don't know we're breathing anymore. So over time, groups of cells get weak in oxygen. Remember, it's our number one ingredient. Number two is water. So we help with water, the quality and the quantity. And then number three would be light energy. And then we also have other modalities to be able to really tend to those cells and get them to repair.
Why does the nervous system stay in danger mode long after the original injury?
It's the sympathetic dominant thing where we talked about the parasympathetic being that healing, calming, relaxing, digestive side, and the sympathetic being the surviving, worried, fearful side. So if you've been not healing for a while, you're developing more conditions. And basically the more sympathetic dominant you get, and it's hard to shift that nervous system to get to heal unless you know what nerves are on this parasympathetic side, how to turn them back on and how to get them stronger again. So the nervous system will just stay in this repetitive cycle of fearful, scared, not healing.
Why does the body react before logic, reassurance, or pain medications could help?
So your body is designed to heal itself. It's an amazing God-given thing. We don't even have to think about it. I always use the example of a cut. If these cells right here are perfectly healthy and I get a cut, the most miraculous thing in the world happens. You'll see that cut just disappear. You can't even tell where it was, and we all take it for granted when it does happen. You'll see another cut, maybe where their cells are not as healthy, and it takes longer to heal, and there's a scar. Because remember, the body did a botched job. It couldn't do its proper job. And then maybe another cut where cells are even more unhealthy, and the cut just doesn't heal. Well, the same thing happens in our bodies. Any cell group that's healthy is going to not develop conditions as easy as something else, another unhealthy cell would.
What starts to change when the nervous system finally feels safe enough to settle down?
So everything changes. The nervous system, when this parasympathetic comes back and the healing side comes back, the body starts to heal these damaged cells. And basically the symptoms go away. The body just says, whoa, I don't have to cry. Those cells don't have to cry out anymore. They're actually healing.
CRPS is often called rare or extreme. How often is it actually just under-recognized?
I think to a certain degree, you could say that people with pain for a long enough period of time, there's a lot of people that could probably be diagnosed with this condition. Because remember, the longer a cell is that's unhealthy, the more likely it's going to turn autoimmune, and it's going to get something like this. And so there's a bunch of different subcategories under CRPS, like I talked about, AMPS, that basically are probably going to continue to grow with more names. But basically, this is when these pain to conditions in the body really ultimately going back to cells that are dysfunctional.
In your experience, how much does stress or trauma intensify CRPS symptoms?
Yeah, so again, when it comes to environmental, physical, or emotional stresses, it could be a combination of those three. It could be a combination of 20 of these three. It could be just one of those that's causing a lot of the cells to be weak. And if you don't fix, and that's part of what we love to do here, we want to find where the brain has lost connectivity to a certain group of cells. We want to restore that connectivity, restore the oxygenation, restore the hydration, and try to get those cells to start healing themselves. But we also want to make sure that the body is strong to that particular stress. So we want to figure out what stressors are in their environment. It might just be thinking about something, about an emotional event that happened that causes your nervous system to crash where certain cells lose power. It's very similar to having like a storm in your body with the stress and breakers shut off in your breaker box.
Why can people feel worse when treatment focuses only on suppressing pain?
So when it comes to the conventional side in this, they're going to try to suppress the immune system, get drugs, and do pain drugs. So children that were paralyzed, they couldn't even touch them. I mean, they had so much pain, it was unbelievable. And they were just screaming and crying all the time, poor babies. I mean, this happens in adults, obviously, too. So we had to gradually make that nervous system stronger. And if we would have done something too aggressively, like, going with somebody that you can't even touch and you walk up with a needle and stick them, not good, right? So we had to progressively strengthen those cells to make the body work better.
Also work with a lot of frequency-based therapies in CRPS and other severe pain cases. What is the body actually responding to? So
frequency is, in my opinion, one of the coolest things out there right now, and it has been for many years. In fact, Einstein in the early 1900s said frequency is going to be the future of medicine. He was absolutely right. And basically, when it comes to frequency, every cell, out of all the 30 trillion cells, every cell has its own tune, like a guitar string. And so each guitar string, a musician that's will go up and say, that string's not tuned, let me tune it. And that's what our cells do. We have stresses in our body that affect the tune of various cells. Think about your heart, it has a different tune. The cells in your heart have a different tune than the cells in your small intestine or the cells in your femur. They all have different tunes. And if we get a certain stress in our bodies that makes that tune lose its proper tune, then it doesn't have the right frequency and it can't do its job. So we have devices now that we use in our clinic that are amazing to reset the frequency of cells. We also have devices for home that you literally put in your pocket and they help to reset the frequency of cells. So now our patients can get relief and help here, but also 24/7 at home.
Amazing. Why are people with CRPS often extremely sensitive to aggressive treatments?
Yeah, absolutely. Those children I was talking about, if I would have walked up and done what conventional did, they were so traumatized because they've been stuck with needles and blood and everything else so many different times that they just didn't even tolerate. If I got my hands here, they didn't even, one of them didn't even want to get out of the truck. He was so intolerant to go into hospitals or doctors that I'd have to go work on him in the truck when he first started to be able to give him the confidence that we weren't going to do what conventional was doing. We were going to listen to what he was saying. We were going to respect how his brain was functioning, and then we were going to get him results. And it's one of the coolest things is when you can't even touch somebody and you work on those cells like we do, and then the next thing you know, you put all these different you can put pressure on them, vibration, and all these senses, and they're feeling things appropriately. It's like those cells have reconnected. It's such a rewarding job.
What happens when the nervous system receives signals it doesn't need to fight anymore?
Those cells in the body, when more unhealthy, right, they're losing connectivity to the brain. And then that's when they don't know what to feel because the signal's not there. So if I go up to somebody that has these little children or even an adult that has this condition and we put something hot on them, they may feel it as cold. We put something hot, they may feel it as pain, right? Those cells, they're just not connected to the brain, so they lose that sense of what they should be feeling.
Why does regulation matter more than trying to overpower the pain?
So it's about resources, and it's almost like God provides the resources for you, but you got to pick the right ones to get you results. And it's so crucial with this condition that you do the right things, because if you don't, you can end up just with a life filled, with something, maybe a condition that you're paralyzed. You can't even touch or move or do anything or work or school, whatever your life this condition hits. If you don't do the right things, it can really mess the rest of your life.
We've seen public figures, including Paula Abdul, a singer and dancer, speak openly about living with CRPS after injury. Why doesn't success, money, or access make this condition any easier to live with?
There's not many of us in the world that are doing what we do here So I think it's just not common knowledge. Most people probably listening to this may have not heard the brain to cells connection, but that's a scientific fact. You need to know about it. I think the big pharmaceutical companies obviously have a ton of money, and they're able to advertise and do things in a way that teaches you, that they're teaching you and they're programming you to believe, you have pain, you need a pill. You have pain, you need a pill. But that's actually not the way we think about it. We think about it as there's a disconnection that needs to be reconnected so the body can actually do what it's designed to do. It should be healing itself, but it just loses that ability to heal itself, and we've got to do the right things to get it to do it again.
We kind of already touched on this subject, but in your clinic, what are some of the most severe CRPS cases you've seen, and what do they tend to have in common, if anything?
Yeah, so the 3 boys we saw were from different families, different time spans, but they all virtually had the same thing. Literally, it was so debilitating. To see these kids come in, and the parents had been to the best pediatric hospitals in the world, trying to help their kids in addition to all the local doctors and hospitals, and nobody offered any help, nobody offered any answers, and little did they know we're right here. So at different time spans, we fixed each one of these children. I mean, literally, that you couldn't touch them. They were in wheelchairs, couldn't stand up, right? And that condition just progressed so much that we did a podcast with one of the moms for one of them that you can watch, and her name's Haley, and you can watch that. We call it the podcast Miraculous. It's really cool, but it not only affected him, with pain, right, and the lack of mobility, but it also to get in his head where they were telling him, some of the doctors were saying, it's in your head. You can walk. Get up and walk. You can do it. Even the top hospitals that they saw, pediatric hospitals, were telling him, oh, you can do it. It's in your head. And the parent, and then they started questioning the parents, saying, are you doing a good job parenting? Is it on you? And people in the community couldn't understand why it happened, but we knew exactly what to do. Just the cells that were not functioning properly, get those cells better connected to the brain. And you ought to see these kids smile. It's the coolest thing when they're in so much pain, and all of a sudden you get them to where they don't have any more pain, and they're walking and they're mobile, and these areas are functioning. So that on a kid's side, those are incredible testimonies that we've been able to witness. But on the adult side, we see it all the time as well, where it's just empowering. As an adult, if you're trying to go to work and you have something that's hurting all the time, you sometimes can't do your job, and it's not what you never go to the level you want to get to. And so when we clear that barrier for people, fix those cells, get them to where they can function without pain, their whole life changes.
Yes. What do both public and clinical cases reveal about the limits of pain-only treatments?
Yeah, so if you just focus on trying to eliminate the symptom, most people will just focus on taking drugs for this. You're the rooted causes, and again, I can't go back to how, in my mind, it's just so clear because we've seen so many of these cases for many years, but the brain just gets disconnected. And until you do something that's going to connect those cells again, you're just waiting on the body to try to reboot itself. And sometimes it do that.
What keeps you working with CRPS cases that others may label as hopeless or untreatable?
That's something we love. I think one of the biggest things we love here is troubleshooting the human body. And then understanding that it's designed to heal itself. So if you do the right things, every person coming to my clinic gets results on every single visit. Which if they come in at a 10 out of 10, we try to let leave here with a 5 every single visit or less. So we try to get a 50% reduction in their symptoms. Now, when they leave here, if the symptoms come back, it means there's a stress in their environment that turned those cells back off. And then we got to try to figure out what stress did that to them and then fix those.
It's an amazing strategy for sure. What is the most damaging sentence someone with CRPS can hear early in their journey?
That it's permanent, that you're never going to get rid of it, that you're going to need medications for life, that your life path's going to be altered, you're not going to be able to do your job, won't be able to provide for your family, or these kids' cases, you're going to be paralyzed for life, right? You're not going to be able to function. And there were several of the top neurologists, pediatric neurologists at the major hospital that told the mom, like, yeah, he'll be able to walk in 6 weeks. He should be fine. And that wasn't the case. So again, I can't impress upon people enough that it's crucial. Like, this world's not getting any easier to live in. The stressors that are around us are increasingly getting more. And so it's crucial that you maintain the brain's connection to your cells.
Yes. Well, that is it for today on our talk about CRPS. Thank you very much, Dr. Cormier. It was a very informative conversation.
Thank you, Kim. So if you really enjoyed this conversation and you felt like, hey, I was speaking to you in it and you could relate to everything we're saying, and you're open-minded enough to understand that the body has this amazing ability to heal itself, you just have to do the right things. Well, we have body chargers that it's an online platform that we've come up with that can help you at home with all of my methods, tools, and resources with this particular condition. If you want to take a deeper dive into this condition and try to fix it even on a deeper level, come to the Nerve Health Institute. We have all this amazing alternative holistic technology, and our center is on connecting your brain to your cells, but also restoring these ingredients like oxygen, water, and light. So I hope you enjoyed this conversation. If you're somebody who's interested, keep in mind CRPS is a pretty popular condition. We can only accept so many new patients a month, but we'd love to help you.